kind of do one step forward, two steps back for a second. So the guide we want to put on once we've actually raised our flap, but I really want to maintain what keratin we do for her, which is pretty much hidden underneath these temporary bridges. So I'm going to use this fun new crazy contraption. This thing's awesome. If you guys don't have one, you squeeze it like this and it removes crowns and bridges. You got to warn the patient, because if they're awake and you don't tell them about that, it can be quite startling. But it is really, really helpful for a quick way to remove stuff. So I'm just going to sneak it underneath the connector, kind of stabilize it so it doesn't jump out of the mouth, and then give it a click and it jumps. So what we're looking at right here, guys, is obviously the implant surgical model here. And on the bottom we've got the guide portion. So this part, depending on the patient, this part and the part that is going to connect on top of it, you can sometimes leave them connected and seat them over the patient's teeth, or you can do it as two pieces where we'll slide this on and then we'll connect it over. But what's really neat about this is how perfectly form-fitting this is to her jaw. For those of you who've done guided surgery before, you know a lot of times when we're working on a pin system, to get past the undercuts, you know her anterior bone right there, it's got an undercut, so you'd have to be able to get over and under, so your guide has to stay well off of the jaw. So you end up hanging out here in 6 to 12 millimeters of space back here, whereas this new diamond lash system from 360 Imaging, it is completely form-fitting, and we're actually going to use bone screws so that we lose that extra big hub of a fixation pin, which is going to be great. But what I'm doing is I'm looking at the extraction sites of where my molars are to try to figure out where the edge of this guide will stop. So I'm going to come back to the distal portion of each molar on each side to do my lateral releases out, so I know that I'll have plenty of room. And we've got it safely designed where there's a little arc built to stay away from the mental nerve. So we'll visualize them, but then we'll stay away from them. Once this is in, we'll pin it in place, and you'll see as we go. But here you can see what we got planned. We got each yellow one is a 4.3 millimeter. This is our only 3.5 millimeter, but it's a 3.5 by 15, I believe. This blue one is a 5.5 by 10, but most of these 4.3s throughout here are like 4.3 by 15 is the average around here. So she's going to get some. So this is where I was talking about. I wanted to have those bridges out of my way so I could really visualize this keratin here, because we have a limited amount. So I'm coming with a lingual bias to make sure we maintain as much of that as we can. So here you go. So you can see the two anterior clear pins right here by my thumbs. I just plugged this clear pin in, which joins the top part with the bottom part.
Okay.
So that verifies that this was mounted on the teeth like we expected, like we planned. It's intimately fitting against the bone, so it proves it's fully seated there. And then once they're joined together, that verifies both of them, so we're able to go forward with our actual fixation screws, which is what's also kind of neat about this is that by having this guide in place right now, it's actually supporting our buccal plate during these extractions, which is always a good thing. All right, so our teeth are out. Sorry, buddy. We're going to switch to alveolar reduction at this point. Again, our guide has never moved because this thing is our foundation for everything going forward, and it's small enough that we were able to do all of that without removing it, which is supremely helpful. We got a runner.
We got extras.
We got them all. All right. Coming off, which, talk about a way to make your day easy. So watch behind the red curtain here once we clear this out. What all's been going on underneath there. And if you guys are looking at any of these posterior ones thinking the buckle's sticking out of the bone a little bit, you're right. We plan on totally grafting there, which is going to come in a minute. But for the most part, these things are darn close to right where you'd want them as far as height goes. So you can see these ones on the anterior, nice and flush, right on the money. What Brian's saying is he trims the height, but then he also bevels down or trims down where the engaging threads are. He leaves one engaging ring towards the bottom, and you'll see when we put in the prosthesis that the channel that he's created to hollow around these is very narrow. There's really not much room in there, but because he trimmed this off, as we flow in the Unisim 2, it's going to be able to get much further down and engage this bottom ring. A lot of times when there are these rings higher up, whatever you're picking up with, it gets bound up top, and you end up with voids and bubbles and stuff down here that are really hard to, if not impossible, to fill in. So Brian's pre-trimmed all these for us. And again, these are the ones that snap on, and then we'll screw them on as well. Good one, or keep trying. One more. All right, Vanessa, can you open and lift your tongue up and back? And then just relax. I'm going to push you backwards here. Yeah, so he's got a gasket with pre-popped holes where our multi-units are going to sit through. This is going to protect all of our extraction sites and bone and everything from having any of the Unisym get in. We did a blood draw earlier on for some PRF, some platelet-rich fibrin. So we have a PRF centrifuge here, which separates the blood out, and it kind of removes the part that's not very helpful, all the red blood cells and things that don't have anything to do with healing. And then it concentrates all the good stuff that has to do with healing, your platelets, your hormones, your growth factors, proteins that stimulate bone growth and encourage soft tissue closure, all good things, white blood cells that fight infection and all. So they preform a clot in the test tube, which then we kind of shred up and mix with some of our bone graft, or you can use it by itself, or you can use it as a membrane because it's So again, we got 1.5 or 1 pound test or whatever on all the units, which is why I'm kind of coming around and popping them up in each area first. Ta-da!
So if you turn it over, Dr. Currie, I'm going to take it back in the lab.
Uh-huh.
Put lab multi-unit analogs on everything.
Yep.
I'm going to go in and fill in any gaps or spaces, clean it up, smooth it up, polish it up, and bring it back. Cut the legs off. Add a little pink composite in those areas, and bring it back ready to go.
Right on. Collagen membrane that's not behaving can be one of the most frustrating moments of your life. So if you can have some little template to try in ahead of time to minimize putting the collagen membrane in prior to when you're ready, it makes your life a lot better. So again, I've pre-punched a couple of spots just to fit over here, which at the time I was putting a multi-unit right there, so that's changed a little bit, but I can see that I like my mesial position and the size of it stays away from that. So I'll modify this one a little bit to come around that healing abutment somewhere in this range right there. To show you guys what our PRF mixed with our bone graft material looks like. It's been soaking up all those good, here. So you can see a bunch of bone graft material in there. This is, again, PRF. This is a corticocancellous demineralized mineralized blend. So what I'm doing, I'm just starting out by just getting any sockets that I see. I'm going ahead and filling those. And we'll do our onlay grafts last, using some of that bone cement, as well as adding some around the facial of some of these. Yeah, so this stuff has about a 3-minute set time. What it's got right here is saline right in there. I don't know if you can see. So saline in this compartment, and there's a blue line here, and I'm going to plunge it until the saline moves into this white stuff up here, and you wait till that first plunger reaches the blue. At that point, all of this is ready to roll, and you've got about 3 minutes before this becomes rock hard. So you shove it into wherever you're trying to do it, press with and hold with dry gauze for 3 seconds, take that out, quickly shape it to however you want it, and move on. So you can get this from Oral Arts in Birmingham, Huntsville. Yeah, I always get that wrong. Sorry about that, Oral Arts. In Huntsville, that's where I got it from. They saved my butt. I forgot to order it for this, and I fully intended to. And so Matt Winstead and his crew at Oral Arts came through Clutch and got it to me this weekend. So you can see our pre-trim membrane comes in handy there. you.